You could look at the problems with primary care from maybe the physician's point of view and also from the patient's point of view. One thing is accessibility and cost. So a lot of times it's very difficult for patients to find good primary care providers who are going to be able to be comprehensive in their care, who are going to be thinking about cost savings, who can do as much as they can locally without referring on to high-cost specialists. And then from the provider, physician, nurse practitioner, PA point of view, lifestyle's a troublesome thing with primary care. There's a lot of uncompensated hours with doing labs and documents and telephone calls, and that really burden the day for the physician. More and more, we're going into value-based and performance-based reimbursement. So that kind of pressure is difficult to solve systems at local levels for the physician when they're trying to take care of the patient, knowing what the value-based model is going to be for them. They have to be very educated, very savvy to figure that out. Even for Medicare or government reimbursement, all the rules and regulations that the individual provider physician has to be thinking about in order to structure their day so they can maximize that reimbursement, do the quality measures every time so that they meet all those tiny little details that government agencies or third-party payers are going to be looking for in a note or for that office visit that you have with the patient. Well, I think organizations are trying to scramble for situations or solutions for trying to make sure these quality measures are met, and in most organizations it comes down to the back of the physician. But in an advanced organization, the corporate level or the administrative level has already kind of figured out what they want to do to maximize the quality, right, of each note and each encounter. And so they do that by providing administrative support for the physician while they're seeing the patient. And there's all this planning that's done even before the physician sees that patient. Like I said, the administrative support staff has already gathered these details, these quality measures, for instance, what the patient's diabetic control is, when the last foot exam was, when was the last eye exam, things that you have to keep track of, but no, it's provided for us before we even see the patient. It's right there, all encapsulated for us. I think that's where really advanced care exceeds expectations from all other primary care organizations that I've worked with.